Hi, everyone. We're glad you're here. This is an open studio of, the title is Systems Thinking Should Drive Every Evaluation. And my name is Mari Gasiorowicz. I do evaluation and systems thinking with Public Health Madison, Dane County. And I was in cohort 2 for the Waters Center's Advanced Facilitator Credential in Systems Thinking, and I'm a whitewater kayaker.
Hi, everyone. I'm Stephanie Lindsley. I also focus on evaluation and systems thinking with Mari at Public Health Madison and Dane County in Madison, Wisconsin. I am an arts and nature lover, and maybe just a little bit of background about what our work looks like here in our public health department. We facilitate a lot of systems thinking trainings. Most recently, we've trained all of our staff on using the habits of a systems thinker and have developed some additional trainings beyond that for those that want to dive deeper into systems thinking skills. Also help programs with systems thinking tools to incorporate into their work. And our evaluation work looks a lot of different ways. A lot of it is internal with our programs here at Public Health, with a smattering of some external work with coalitions. Sometimes it's really short project-based asks like developing a survey or focus group questions, and sometimes it's to the other end of really diving in and doing a full evaluation plan and helping collect the data and analyze it, report on it. So it looks really different. And our programs here at Public Health range from a lot of different areas. We have some really client-facing programs like maternal and child health. We have restaurant inspections. We focus a lot on cross-agency work like health and racial equity. We also have violence prevention. We have a lot of different programs here that focus on a lot of different aspects of public health that we support. Yeah, thank you. Just wanted to give you a little bit of background on our work.
So we want to acknowledge our mentors in systems thinking. Kathy Zerker, who trained us on systems thinking a bit pre-COVID. Sherry and Tracy were mentors during the cohort, and then Drea has supported us in developing this session. So we're going to do a quick poll here. There's a range of experience probably with evaluation in this group. And so when I say the word evaluation, which image resonates most for you? The elephant, the guillotine, the onion, question mark, person either doing yoga in a weird pose or reflecting, a graph or a map. I'll just give you a minute here. And what we see with this group is that, interestingly, many of you selected the map. Next was the question mark, the onion, presumably layers of the onion, and then a number of you with graph. Nobody picked the guillotine. That's an interesting thing. Some people are very afraid of evaluation and they view it as quite punitive. And then the elephant, I guess the metaphor there is, the ear feels one way, the leg feels another, and the tail or the trunk feels another. So anyway, just to warm us up here and think about evaluation. So our objectives here, by the end of this session, we will articulate why every evaluation should be informed by systems thinking. So this really, is bringing together the worlds of evaluation and systems thinking. You'd be able to name a tool to evaluate a systems change initiative. So one is that is specifically calling itself a systems change initiative. So we'll talk about a couple of those. We'll, in groups, create a system map and then use the map to identify evaluation questions. So here's our agenda. We are now doing the introduction and agenda. We'll talk a bit about evaluation and systems thinking, create that map, and then reflect and look at resources and so on. So this session really came out of a blog post that I wrote in December, making the case that all evaluations should be systems evaluations, even if it's not specifically calling itself a systems change intervention. And so, so that's where this came from. Post that at the end. So many of you may be familiar with the 6 conditions of systems change. So this is a model that looks at how do we achieve systems change. So really at the structural level, and this might remind you a bit of the iceberg, a bit, although it's shaped differently, but structural change policies, those could be, we think of capital P policies, changes for at the state or local level, national level. Small p policies or internal practices within an organization. For a while we have, something on breastfeeding at work, policies on using your computer on your own time, whatever those kinds of practices. Resource flows. So, what's going from the federal level to this state level to the local level to local organizations, or however that goes. At the next level of relational change, relationships and connections. And challenging, I think, is power dynamics. How do those change over time? And then, as we're familiar with again, from the iceberg, changing mental models is challenging, but it's also a powerful aspect. So that's really transformational change. So a couple of explicitly systems change initiatives, one being a coalition. So we have, in public health, we have lots of coalitions, violence prevention and substance abuse, mental health, in other areas. And, if we just wanted to fund some organizations to do X, Y, Z, we don't need a coalition, right? The purpose of a coalition is to bring people together to achieve a shared goal. And there we're really looking at developing relationships and connections. That's how we think that change occurs, is by developing those relationships, not for the relationships in and of themselves, but what those lead to. So if we're trying to, if we believe that the reason these coalitions work is they're developing relationships, then we want to measure the strength in those relationships. And so to do that, social network analysis is a great tool. So at the beginning, assessing, you've got, in this case, you have 17 people, and what are the relationships among them? So if there's a line, there's some kind of relationship, and the darker the line, the stronger the relationship. So this was a cohort of people being trained in community organizing. So of those 17 people or nodes, there were relationships among 19% of them at the beginning. Well, at the end, there were relationships among 53%, and you can see that the lines have gotten darker. So, so we asked, is your relationship kind of, hi, how are you? A little bit deeper, a little deeper, and then, hey, we collaborate together, we write proposals together, whatever that is, and those are the darkest lines. So this is a tool to actually measure the strength of relationships among people in a coalition. And this is a way of demonstrating that, yes, the coalition did, achieve this deeper level of connection. Another systems change approach, this is an educational initiative, and the goal is really to change mental models. So this is a Black history class for non-Black adults, and it really dives very deep into the history. There are university professors that give a lecture, and then people are in small groups kind of talking through the issues over a 10-week, 2 hours a week period. And so we're hoping to see changes both in people's individual mental models and then behaviors. So there, a tool, an evaluation tool, it's called ripple effects mapping. And so we're asking people, you can see my colleague there facilitating, asking, well, what, after the class, what happened? What at the individual level? So then people are talking about, well, at the Thanksgiving table with my relatives, I'm having different kinds of conversations. I interact with my Black colleagues differently than I used to. I don't, say things that I didn't realize were microaggressions, and I'm aware of that. And then within my organization, things have changed within hiring and contracts. And then beyond the organization, people gave examples like, oh, we're revising our request for proposal process. So that doesn't just affect, um, it's affecting all these other organizations, or a school district improvement plan that then is affecting multiple organizations. And the ripple effects mapping is, somebody says, oh, well, I came back and I did a session with my faith community. And then that led to a lot of other people within my church synagogue taking the class. And then we formed a group that did this. And then some people took it out to their workplace. And so you end up with these ripples that go beyond just the people who took the class. So that's another example of a systems evaluation tool that's really looking at, these are both examples of interventions that think of themselves as systems change interventions. So for these kinds of things, there's an online resource put together by FSG called Evaluating Complexity, and it has a table of, if you're trying to do this, here's a description, and these are some helpful tools. So systems mapping, which we'll do, social network analysis, surveys and interviews, of course, we're all familiar with as evaluation tools. Anyway, this is a great sort of Bible of systems evaluation that that I recommend if you're interested in that kind of evaluation. So in evaluation, we ask a lot of questions.
We do. Thank you, Mari. Yeah, we're asking a lot of questions as we're planning the evaluation, working with our partners on that. And then we're also always trying to center in on a handful that we really need to answer through the evaluation as we think about data collection analysis. And really what I want to do in talking about the questions here is really talk about how we weave systems thinking into the evaluation as we're asking these questions. All right, so one of the approaches we use is the model of results-based accountability. You can see the three core questions there. We've used this a lot in our health department, both in performance management and expanded evaluation work. We're really thinking within this model, it's focused on about the ends we are trying to achieve and then working backwards towards the means. And the third question here, especially, is anybody better off, really helps us to center how the elements of the system are working together to achieve the desired outcomes in the evaluation. When we're thinking about is anybody better off, we're thinking about are those we're hoping to impact better off by our work, or there's still, like Mari mentioned, those 6 conditions, or there's still conditions within the system that we need to work to change. And we're also always in our evaluation work thinking about equity. So these questions here we're asking as we're planning. So who benefits from the intervention or systems change initiative? Who might be harmed or left out? What unintended consequences might result, which will tie back to the habits in a minute. Just one sec. I'm just going to say a few more things here. So yeah, we're really focusing on historically underrepresented groups, and really just how they might, be harmed or benefited, and the unintended consequences, just like this habits card here. Habits are so helpful in evaluation. Any of the cards are incredibly valuable. They have great questions for planning and also some great questions to think about answering in an evaluation. With this one here, considering the short-term, long-term, and unintended consequences of the actions, we're really thinking about, okay, if we implement this systems change initiative, what are the effects down the road? We might be thinking initially on the short-term consequences of the action, the short-term effects, that sort of thing, but we also really want to consider what might happen long-term. What might this change make within the system that we're working within, and how might it affect the people that we're hoping to impact? So yeah, we look at this question and really think about those things. The other habits cards is that all of them are incredibly helpful in an evaluation, but just wanted to highlight a few other things that we're always thinking about as we're weaving systems thinking into our evaluations. So these patterns and trends that are emerging over time, how do the parts of the system affect one another? And as we were just kind of talking about, how do we, if we make a change to the system, as we hope to do, how long before we anticipate seeing the results we desire? So yeah, within our department, we've, as Mari mentioned a little bit earlier, we've given all of our staff habits cards. We have a training and really just trying to help them through additional training communities of practice as well, like weave this into their work and really be thinking about these questions and these cards as we're thinking about evaluation.
So one piece of work that we did in housing was interviewing quite a large number of people about health and safety and low-income rental housing. So the setup of those interview questions was to say, hey, we're taking a systems change approach. And what we mean by that is we want to create a picture of the existing system, the desired system. We want to look again at strengthening relationships and really that avoiding blame, because it's easy in housing, to talk about owners and property owners and managers and, oh, it's all their fault. And it's complex, right? There are a lot of pieces of it. So that question, how can I focus on the internal causes rather than external blame? So the interview questions then, some of those looked at asking about what are the underlying causes of how we got to where we are, what is the impact on renters, what are efforts that we can use or you've seen to move things in a positive direction, and then what other perspectives should we pay attention to? In other words, who else should we talk to? So we really looked at David Peter Stroh's book for some specific questions to use as we were asking, talking with people. So we will create a system map and use it to ask questions. First, we'll walk you through an example. And I just want to highlight that, we could have used any number of tools in this session to focus to talk about evaluation questions. We're using this system or kind of network map. It's not a causal map. It's not behavior over time graphs, which we know are a great tool. There are any number of tools, but this is one that we've used quite a bit at our health department, and it's people respond well. So in creating our map, we want to clearly identify what is the system that we want to map, and sort of embedded in that is, what are the boundaries? So in our case, we're a city-county health department, so that tends to be the boundary. What are the elements of the system? So the people, the organizations, the resources, regulations, databases, even mental models. What are the prevailing attitudes about X? We want to decide what or whom to center, identify where the connections are, between this entity and this one, which direction do the arrows point? So what is affecting what? In some cases, both affect each other, and in some cases, it's pretty much of a top-down, this affects this, but not the reverse. Where is the system? Where in the system is our blank? Our school, for many of you, our health department. When we were talking earlier about coalitions, some of you might be familiar with the collective impact model for coalitions, and sort of a couple of key pieces of that is they have a common agenda, mutually reinforcing activities, and there's a backbone organization. So in our case, you'll see that we are the backbone organization for a number of coalitions or entities related to what we're talking about, gun violence. So looking at where are we in that system? So of course, depending on who's drawing the system, it will look different. And then importantly for this webinar, we want to focus on what questions does the map raise and what observations do we see? So here's the first cut of the map that, the gun violence map. We've done a little bit of work to make it a little more legible. So, so in creating this map, we have these colors. So blue, who is centered. Green is the units within, in our case, the health department, but in the ones that you'll do, it's a different entity. Who are the partners or the other players. And then the things, which aren't all things, but they are non-people, non-organizations. So the violence prevention and intervention team decided that for the purpose of the gun violence work, they wanted to center youth experiencing or involved in gun violence. Which units of our department are involved? And this is really just some of them. That's a great question. Who did we create the map with? It was members of the of the violence prevention and intervention team. Now, ideally, you'd be doing this with a much broader community, or at least showing them and saying, what have we missed? So, but for our purposes, yes, we did this with internal team members. So, but we also had budget and finance at the table. Probably if they hadn't been there, we wouldn't have thought to put them on the map. So from our health department, we have the violence prevention and intervention unit, but we also have us, the evaluators, the epidemiologist, policy analyst, communications, budget and finance, and then there are other players that we didn't list. And then these two green that are surrounded by the gold, these are coalitions that we lead, we as the health department, so we are the backbone organization, but we're one of a bunch, and so so it's surrounded by gold in order to indicate the partners, which are some of whom are here. So you expect the police, schools, talking about youth, shelters, violence interrupters, local social workers in the neighborhood, youth organizations, and so on, but also the public, the media, elected officials. And there are more. What about these things that we want to include on the map that affect our system? So there are federal laws, state laws, local ordinances, access to guns, norms about guns that are different, let's say, in parts of Madison than they would be up in northern Wisconsin, where many people hunt. Things like data privacy laws, data sharing agreements, and then post an event, an incident, healing circles, listening circles, and healing events. So those are some of the things that are on the map. And then what should be connected to what, and which ways do those arrows point? So for example, I mentioned the listening circles, the public attends those. The violence prevention unit organizes those, and budget and finance is critical for making them happen. That's just one piece. And then here you can see these laws, and that's a way that things really move down. It's less so that the state laws affect the federal. And this is a big, huge map that's, I know, a little overwhelming, but it does sort of help us, put things together. And then really our question is, so what questions does this map raise for you, or what observations? And I am interested in what questions this raises for you.
I can share a couple that came up with our violence prevention unit after we talked about this, just to get people thinking. Where should we begin? That's an excellent question. some questions that came up were looking at the arrows, the 1 and 2 ways. Are there places where it's just going one direction, but we'd better do our work if it was actually going both ways? Thinking about those relationships, and then also thinking about, are there entities here that are missing, that are part of the system that we don't have any interaction with? Being siloed is definitely something that comes up within our work, and something we think about within systems. And Mari, I'll let you talk a little bit more about some of the other ones.
Yeah, I think people have raised excellent questions here. Where should we begin? What is a violence interrupter? And yeah, that's a particular, we fund an organization. Well, I guess we don't anymore. We used to fund an organization that had people in the community who had, you know, experienced violence and were working with youth. Um, so, uh, what sectors besides public health have a stake in the issue? And that's a great question. And of course, there are many. And again, because we're doing the map, it looks different than if police or the DA's office or the schools or the youth themselves made the map. I love this question. Why are so few arrows connected to the youth themselves? And I think that's a really good question, quite a profound question, and there probably could be more, but I think that's quite an important question. Yeah, it can be overwhelming, and why are we mapping this? And and ideally, it is to raise some questions. These are excellent questions. And I think what we'll do is, because you're all raising these kinds of things, and you'll have an opportunity to kind of practice, is we will now go to the Google Slides, where we'll be doing work shortly in groups. So I'm gonna okay. So I'm gonna let you open the slides on your own. And so I guess raise your hand if you're having trouble with that. I just put the link in the chat. So I think it's a good point that the schools, yes, schools would have arrows. So there's some missing arrows here, so that's for sure. But okay, so are you seeing, have you been able to open the Google Slides? I'm getting at least a couple of thumbs up. So I'm going to talk through a little bit, and then we'll release you into your groups. So this first one is just a title slide, then just letting you know you're going to be popped into groups, either to be mapping out the system that is a parent-teacher organization, a citizen science group monitoring butterfly populations, or a local substance use and mental health coalition. And we know that you're not experts, any of you probably, on any of these. Some of you are experts on some of it, but it doesn't matter. You know enough to be able to, work in these groups. On slide 3 are the instructions. So you're going to find your maps page, and those are listed here. Identify what or whom to center and color it blue. Arrange the elements on the slide. You can add, subtract. We'll show you a slide, and there are arrows on there. So let's go to slide 4, just so you see for the PTO map, which has a brown triangle there in the corner, so you know that those two are your slides. So you can arrange these elements, connect them with the arrows. So do those pieces. And then importantly, the next slide is slide 5 for the PTO, and it's the same for the other two groups, listing some questions, evaluation questions or questions and some observations, and you can add more bullet points than that. And then slide 6 is the same thing. Okay. Yeah, so then, same thing for the citizen science groups 2 and 3. And then starting with slide 10, just if you want it for reference, is the slides that we walked through, all the way down to with the questions. And then the very last one is just some resources, just so that you have that if you want it for later. So any questions about what your task is here before Sherry pops you in groups? And Stephanie and I will drop in, not to advise, but just to listen, so we can kind of hear what's happening. Off the chat and see, yeah, lots of comments about the gun stuff, but I don't see any questions about the lacking clarity on this. So Sherry, I think we can send folks off into the groups. You've got about 12 minutes. We're